I want to talk about that a little more because, as you said at the beginning of this conversation, you think aspects of this bill are cruel, and I'm assuming you're talking about cuts to those social programs. So, when you're looking at this bill, when you're looking at the tax cuts paired with the changes to social programs, estimates say that this legislation would make the poorest in this country poorer and the richest Americans even richer. And so, Medicaid cuts, there's going to be estimates say between 8.6 and 14 million Americans who could lose health insurance over the next 10 years, and around 3 million people could lose food assistance with SNAP. I've had plenty of Republicans on my program here. I asked them directly about Medicaid. Each of them have said to me, your coverage will not be lost. We are not touching your Medicaid. We're going after the waste, fraud, and abuse. President Trump himself has said, we're not going to touch your Medicaid. We're going after the waste, fraud, and abuse. I mean, what's your reaction to that rhetoric versus what we're seeing coming out of this bill?
Well, the sad reality of this is that they're talking about work requirements, and that sounds good until you unpack what it actually has meant, where it's been implemented in states like Arkansas and Georgia, where you have people who do qualify for Medicaid, but run into all the bureaucracy and the red tape that is put in place by these requirements, and they wind up not getting the care that they need because they don't meet the bureaucratic requirements that are imposed. So I see this really as weaponizing the bureaucracy against people in a manner where they do qualify for the care, they do actually meet the standard of the work requirement, or they meet the exceptions to the work requirement, but because they don't fill the paperwork out promptly or correctly, and because those bureaucratic requirements are onerous, then they're not getting the care that they need. And what you just talked about, the estimate of around 8 million people that'll be booted off of Medicaid, that's not something that Democrats made up or something that was partisan. That was a nonpartisan, independent analysis that was conducted that resulted in that number. And that's a direct result of what we know has happened in states like Arkansas and Georgia, where these bureaucratic hurdles have been imposed. We all want waste, fraud, and abuse out of government. I just think this is not that. This is something fundamentally different. It's a backdoor way to cut millions of people off Medicaid. And then the other thing I should mention is the Affordable Care Act. So you mentioned that overall number of around 14 million. That includes roughly another 5 million people that will lose coverage under the Affordable Care Act because the premium subsidies that were put in place in order to try to incentivize people to get on the ACA exchanges, those are going to be taken away. And so you're going to have another 5 million or so people that are going to be without their Affordable Care Act health care. And so you add it all up, and it's just a really, really, in my view, immoral piece of legislation that will result in a lot more people getting sick. And it seems to be the Republicans' health care plan is don't get sick.